This week on Heal Yourself Radio, we talked to Dr. Spencer Barron, who is the chiropractor for the Miami Dolphins. He's going to be talking about sports performance and how to optimize your sports performance. We're going to talk a lot about concussions and how conservative management of concussions can be the answer to help solving some of this concussion epidemic. And we're going to have some fun and talk about what things that the average person can do to increase their performance and the performance of their kids that are playing youth sports. As always, if you're enjoying the show, then feel free to leave us a comment on our website, healyourselfradio.com. You could also find me on Twitter at drjonathanchung. And you could also do us a big favor and go over to iTunes, write us a 5-star review. We're also on Stitcher now, so if you're on Stitcher and you're listening, then go ahead and give us a 5-star review as well, and it's always appreciated. We have until the end of the month. This is June for the Christmas Abbott book contest. If you want to win a copy of Christmas Abbott's book, The Badass Body Diet, then go ahead to healyourselfradio.com and register by becoming a subscriber to our newsletter, and you'll be automatically enrolled for an opportunity to win that book. So here's Dr. Barron. Enjoy the interview.
You're listening to the Heal Yourself Radio Podcast. Unleash the Doctor Within with your hosts, Dr. Jonathan Chung and Dr. Gregory Jean-Pierre.
Welcome to another episode of Heal Yourself Radio. I'm Dr. Jonathan Chung, and as always, we are breaking down the secrets to optimal performance and giving you the ability to take better care of yourself. Today's guest, we have Dr. Spencer Barron. He is going to talk about a functional neurological approach to concussion management, and he's a sports chiropractor. He's a diplomat in the American Chiropractic Board of Sports Physicians. He's also the team chiropractor for my Miami Dolphins, and he's also an author of Secrets of the Game. Welcome to the show.
Hey, Dr. Chung. Thanks for having me.
Well, I'm glad you could join us. I really wanted to pick your brain and really break down this concussion issue. But first things first, can you give us a little bit of background about yourself?
Well, sure. I always wanted to be in the sports field somewhere, something with health. Thought about being a medical doctor or an attorney, but never felt that was the ideal situation. And someone said one day, some 35 years ago, you'd make a good chiropractor. And I go, chiro what? I don't even know what that is. And then the more I found out about it, the more it just suited me ideally. It was a very wholesome approach to caring for people. And it didn't seem as antiseptic as medicine, and it didn't seem as win-lose as being an attorney. So I felt that, this was a real, proactive approach to taking care of people and really model it to the way I imagined the future to be. Hence, here it is, 30 years, 29 years of being a chiropractor, and ended up never imagining to work with professional athletes at that caliber. It was always working with anybody who felt activity was a part of their life, keeping active. And it just morphed into a specialty and became such a wonderful experience. And the communication I have with athletes at all levels seems to inspire them to take better care of themselves if they don't already do so. So it's been a wonderful journey, and constantly embarking on new things. And I appreciate you for being so involved in concussion, because that is the mystery epidemic of the decade. And any way that we can help in a healthy and natural way, I'm all for that.
Awesome. And I think that's one of the big things that I really wanted to talk about today, is because right now the biggest idea within concussion management, especially when it happens recently, and we just watched Klay Thompson and Steph Curry get hit with some concussive forces, is the mainstream thought is that we should be just waiting and seeing what happens to the person after they get a concussion. What are you seeing in trends nowadays that are they the same? Or are they starting to drift away from that?
Yeah, actually, what is amazing is that, some of your listeners would really remember the days where a concussion meant that you were knocked out, blacked out on the floor, just unresponsive. And then in sports, the next action would be to walk up with one of those breakable little ammonia inhalants, wave it under the nose of the person that's laying there cold, and then they, suddenly wake up and go, oh, okay, and as if they came to all of a sudden. Wow, we have evolved so long, so much, and so rapidly since that day. And what's even more amazing, Dr. Chung, is that from 1 month to the next, everything down to the pathology, to the physiology, to the management, the prevention is changing at such a rapid pace. And like what we talk about today, uh, maybe a bit different next month or in a couple months.
Yeah, I think it needs to be, just given how much of a spotlight that head injuries are taking in sports right now, because the soccer community is talking about it, hockey is getting more scrutiny, and of course, everyone knows about what's happening in the NFL with the lawsuits that are going on, and just the implications with things like CTE, chronic traumatic encephalopathy. We need to know more about what's going on with this, and we need to give athletes answers to how they can play these sports that they love without having a fear of being having dementia and possibly dying early because of the sport that they played.
Dr. Chung, I got to tell you, I have to be careful about always talking about the sports world. The sports world is obviously, just concussion is pervasive in the sports world, but your listeners might think, oh, I don't know anybody who's had a concussion. I don't play sports or anything like that. But guess what? Their kids are riding roller coasters. Their kids might have been in car accidents. Their kids might have been in a 10 mile an hour fender bender. No injury to the vehicle, but the occupant takes that velocity in head motion and bangs against the car seat. I mean, think about it. Or I just spoke to a guy. I lectured in Illinois, and a doctor came up to me. He was overweight, obviously didn't play sports, but he sustained a concussion. And guess how? He was putting his child in the back seat of the car, and as he got out, he hit his head so hard on the door frame to the car that he blacked out.
Wow.
And needless to say, actually, to be even more scary, there's a sequela to that story. I didn't think to bring it up, but that injury, that head injury, even though it maintained control and he was fine afterwards, what was it, 6 months to a year later or more, when that concussion was long in his history, he ended up with non-Hodgkin's lymphoma, a tumor on the brain at the same exact precise area of the head trauma.
Wow.
Now, I think we as chiropractors need to be involved in the care of those injuries long before they turn into stuff like that, because then we can't do as much when it becomes a wild and crazy injury that takes different forms. But we'll get into that conversation in just a moment, I'm sure.
That actually just brought to my attention this article that got published in Nature, actually today, I think, where they actually found some lymphatics inside the brain, where we had thought for the past 100 and some odd years that the brain had no lymphatics to drain. And that just provides a pretty reasonable mechanism for how something like that can happen when you disrupt what happens inside the skull, you disrupt the brain's ability to clear itself, and lo and behold, suddenly a concussion can evolve into a more substantial disease process.
You are so right. And you know what? We could probably swing from one research paper to another, because actually, you just mentioning that sparked the realization that I read a paper last year that had nothing to do with concussion, but had everything to do with why sleep is so important and what actually goes on in the brain and how the lymphatics clear the brain of just like the rest of the body cleans itself of the any impurities in the system. And sleep, during sleep, they found that the lymphatics work the most in clearing the body out, or the brain out of impurities. So, gosh, I didn't even think about that part. I didn't, this was an article I read unrelated to concussion. It was just about brain function and why sleep is so important. So imagine not getting the proper sleep because you injured your head, and that's obviously going to not only cause blood pooling, dysfunction of the neurons, but now the lymphatic system. So again, look at all the things that we're learning here, even to this day, and I can't imagine what it's going to be like in the next several months, even.
There's no question. And one of the things that I'm kind of having a conversation with now is I feel like concussion, like a head injury, is almost like the diabetes for the nervous system, where diabetes leads to all these heightened risk factors for all these other cardiovascular disease, where when someone has a concussion, it leaves people so at risk for all these neurological disease. And that's kind of the way that I'm seeing things now, and with a lot of the work that I'm doing and a lot of the research that I'm looking into.
Yeah, it is fascinating. It's an area that is so, it's evolving even down to how the nervous system, or let's take the individual nerves of the brain. People just, here's the funny thing about us as human beings. If we don't see it, we don't think it's there. So if I banged my knee, my thigh up against the corner of a table, you see the bruising, you see the injury. If you bang it again, you realize, my gosh, that hurts 10 times worse because it's already a sensitive area. The brain is the same way, but just because it's encased in this hard shell and we don't see anything, we don't think anything's there. But my gosh, these little nerves get damaged, and as well as anybody that it takes a long time for nerves probably of all the tissues in the body, takes the longest to heal. It's the most sensitive, in the spinal cord and the brain. So it is so desperately important to manage every case individually and to make sure that you create the best environment, and that's nutritionally, that's chiropractically, that's your environment around you at school, at work, at home. And the days of even just thinking, hey, let's stuff yourself with whatever food that person's hungry for, put them in a dark room and let them heal. That's not the way to do it. In fact,
Definitely not.
they're finding that actually will lengthen your downtime. It's actually as bad as if the other end of it, where people don't pay attention and they try to be active and continue with the video games and the watching movies or TV, and just because they hit their head doesn't mean that they want to slow down a bit. There's got to be just the right amount, and obviously you as a chiropractor who enjoys this type of taking care, managing this type of injury, would understand that and is able to nurture that patient along.
Definitely. So what is the response that you're finding from some of these high-level athletes? What are their thoughts about what's happening with concussions? Are they afraid? Is it just something they see as an occupational hazard?
Yeah, there's mixed emotions, as you would expect, with the number of professional athletes there are, at any profile, high and low profile. It's an attitude of winning. You get paid well now, but even when guys weren't getting paid and getting injured fiercely, the the interest in the element of competition and winning is sometimes so far outweighs what's going to happen tomorrow. Well, here's the other part of it too. You and I may not tap into that understanding because we care about our health and we are proactive about how we feel tomorrow and the next 10 years from now. An athlete has a different mindset. As much as they're aware, some of them go ahead and take the risk because they don't quite care about what happens tomorrow. They will do whatever it takes at all costs to win today. And listen, what can we do? Well, now I'm recruited or you are recruited to do the best you can to take care of what they've got and to try preventative techniques to create optimum nutrition, to strengthen the neck muscles to make sure that there's great stability for that head to sit upon the neck versus a weak neck that would almost be like putting your head on a spring and letting your head bobble around like a bobblehead versus your neck being like a 2x4. So there's proactive things that we do. Apply the principles of chiropractic, make sure the spine is set in proper motion and in a static position is an ideal position. So it gives a fighting chance to these professional athletes, or any athlete for that matter, that cares a little bit about what happens to them tomorrow versus just caring about the win.
Sure. And I know that you're doing some training, additional training in functional neurology because, you don't have enough on your plate now. But what are some of the new ways that functional neurology is looking at a concussion injury, and what are some of the new therapies to help address some of the problems with it?
Great question, Dr. Chung, because that's what really jazzes me nowadays is that understanding of what functional neurology can do. Basically, functional neurology, let's take a regular neurologist. A regular neurologist looks at the condition and gives you a diagnosis and most likely will give you medication. A functional neurologist, which is primarily composed of what, like for us as chiropractors, we can take these courses in functional neurology and get a diplomate in that as well. And what that is an understanding of the condition that's going on with the brain and spinal cord or the nervous system in a more dynamic relationship and to help strengthen those injuries. It's almost like saying, I fractured my leg, and the way a medical doctor would manage it would be or an orthopedic management would be, let's put a cast on it. Here's some pain-killing medication. When it heals, we take the cast off and try to strengthen it. Well, a sports physician, a sports-oriented physician, looks at it completely different. So we would look at that injury and less likely cast it and provide certain activities almost immediately following the fracture. Now, those activities are like maybe drawing the alphabet with your toe, those kind of things. As well, a functional neurologist looks at, providing function, identifying what areas of the brain have been affected and how do we re-strengthen the nervous system and how it integrates with the rest of the body. So if I hold my hand up and try to touch my index finger to my thumb and I just had a concussion, well, a regular neurologist may not do anything. There isn't any medication to take. There's no algorithm for sending out for an MRI. That's just his opinion at this point. But a functional neurologist would identify what area of the brain is tapped in, is involved with bringing your index finger to your thumb. And because you can't do that very quickly, we know what area of the brain that's affecting. Let's strengthen it, or let's care for it. Let's monitor it. Let's provide exercises, kind of like what I said about the fractured leg. the leg with the fracture that doesn't get casted. So listen, you know, I believe, and what I'm reading now in the literature is rest after a concussion is too much rest is actually just as bad for you as too much activity. So a functional neurologist would understand that and provide, the right tools to manage through that. Sorry, that was the long answer. I apologize for that.
No, that's okay. I think it's good to get in depth with a medium like this. And I think one of the things that you touched on is using exercise as a way to strengthen the brain. A lot of people might be confused about that, and it's just the understanding needs to be had that because of the way that your nerves connect into the muscles and the way that the muscles give feedback to the brain by doing exercises, you are actually changing the brain because you're activating these nerves that need to strengthen or weaken connections depending on what level of activity that person needs for to accomplish tasks of their daily life. So just doing something like, placing their thumb and their forefinger together might be important for an athlete in some way, and it helps identify, all right, if this pathway is weak, there might be other things in the brain that are weak as well that are creating that type of problem.
Yeah, and I would be remiss if I didn't mention, and I know you're a chiropractor, I'm a chiropractor, and of course I'm going to be biased to my profession, but I need to share with the public something that's emerging as part of the rehabilitation for concussion that is so absolutely, without question, imperative to the public that has sustained any sort of head injury. And that is conditions that involve, whether it be dizziness, any kind of movement or posture imbalance, or any visual disturbances that person might be experiencing after a concussion, that their reflex reaction would be, oh, I injured the brain. I got headaches. I must have injured my brain. And 9 times out of 10, that may not be true. What may be going on, which is absolutely imperative to the patient, to the athlete, is to be concerned about what we call cervicogenic conditions that mimic head injury. What I'm saying simply is that manual therapy or caring for the neck is absolutely important, because there are very few modes of concussion that do not involve the neck. Most concussion involves the neck, and those symptoms that are generated from what you and I might call whiplash are actually the same types of symptoms that go on with the actual head trauma, a mild head trauma even. So people can easily be diagnostically confused, thinking that they have a head injury when it's really just the neck. Thank goodness.
Definitely.
And who better to take care of the neck than you and I?
Yeah, absolutely.
That's an absolute, because we do it without medication, and we really involve the patient in a more functional environment, so they can feel like they're participating in their care rather than just taking medication.
And I know this is something that you presented on the bed, is just how powerful an input that a chiropractic adjustment to the neck can have an influence on the neurology of the brain. And I know one of the things that we're looking at in NUCA is the effect that the alignment of the neck can have on the drainage of things like cerebrospinal fluid and the lymphatic system of the brain, and how that might affect things overall from a concussion recovery standpoint too.
Yeah, very much so. As a matter of fact, there's some really progressive research coming out, and actually there's one of my favorite articles is out of the Clinical Neurophysiology. It was actually done in 2007 fascinatingly by a chiropractor and the team of investigators on the effects of how cervical spine care and manipulation can actually change some of the cortical mapping that goes on in the brain. In other words, when I adjust the neck, I can have an effect on the brain, an enormous effect on the brain. And most chiropractors don't even realize the profound effects that now research is starting to shift from low back and neck problems to what is happening in the brain after a spinal manipulation. And this is work not just done by a bunch of chiropractors. They're the osteopaths, medical doctors, the researchers, PhDs, they're all looking into this. And who corners the market on manipulation but the chiropractors? So we knew something was going on and making an effect. Now it's being documented. And this researcher out in New Zealand, Dr. Heidi Havoc, is doing an unbelievable job on presenting information on how we can boost cortical mapping and affect the neocortex of the brain to inhibit pain and other primitive limbic structures that have an effect. So because people that traumatize the head, that even if it's mild trauma, they will actually be poor inhibitors of pain. So in other words, what that means is, you stub your toe and I stub my toe, but if you had a head injury, you're going to feel that same effect much worse because of how irritated the brain is, and it's going to perceive pain. You ever have, here, I'll give you a perfect example. You ever have a headache and somebody's yelling? It's like, you cower down, like, enough already, that hurts my head. Okay. That's a similar effect as what I'm talking about. So they're finding that cervical manipulation can actually play a enormous role in inhibiting pain. So, I mean, come on. Do you know what that means? I feel like this is Star Trek. I feel like everything that they did, when we would watch, well, not you, you're younger than me. When we
I watched the new school Star Trek.
Right. Well, when I would watch Star Trek back in the day, 30 years ago, the things that Bones, the doctor, would do back then, they're doing now. It's just all that cool stuff. Well, same thing. We're realizing that what we can do with caring for the neck can have an effect, a profound effect on the brain. And there's a really, really, really cool one. I usually share this with I would actually absolutely bore to death the listeners, but what I share with some of the medical professionals is, why does an adjustment of the spinal bones of the neck have a profound effect on dumping those endorphins through something called a periaqueductal gray matter, which is an area of the brain that is rich in endorphins, which are pain-killing, natural morphine-like substances that the body spews out to get you out of pain. We usually feel it during a long-distance run. We feel it eating spicy foods. We feel it overeating. We feel it during sex. We feel it during, when we're in pain, and that is the body can an adjustment can facilitate that kind of reaction. Sorry, I'm getting crazy. Go. Interrupt me, please. I'm getting all excited about
No,
this.
it's amazing stuff, and definitely one of the things that chiropractors have known all along is that when you work on the spine, you can have a profound impact on other seemingly unrelated structures, and a lot of that is now showing that it's because of the impact that it has on the brain and the way the brain impacts the rest of the body. So it's completely really, really interesting stuff that's going on in the field of chiropractic research. We just need to get some more money into there so we can get some bigger sample sizes and get that stuff moving.
Yes, absolutely.
So I want to switch gears a little bit. I want to talk about, I know another passion of yours is human performance, sports performance. And I know you wrote a book, Secrets of the Game. I want to kind of delve into some of the things that elite athletes do for their bodies that not enough people know about, that increases their performance.
Well, I've realized that the basic premise of chiropractic is mental, chemical, which they call, it's nutritional, and physical. So those are the three areas that we can modulate to have an effect on performance. So, really what you do, what most chiropractors do on a daily basis is we don't just, check out how your low back pain is, but, you, you, we really listen to our patients and understand. So, I mean, gosh, Dr. Chung, I do the same thing you do, only I happen to work on Ferraris, or Lamborghinis. It's really a similar approach. You're a conscientious doctor. We get out there, we listen to the patient, we hear that their hip hurts, but yet you hear other facets. We are great listeners. And so we also love to play detective, and that's basically what I do with high level athletes is you play super detective because if you've ever owned a high performance car or even watched a TV show where the guy pulls his car in, his Ferrari or Lamborghini in, and I mean, the average person, you'd go, oh, wow, what a beautiful car. Listen to that engine. But the mechanic goes, ah, I hear a little sound and he knows right where that is. And that's basically how I work with the athlete. We can take the little most minute change or problem that's going on, change it ever so slightly, and that could shave off a millionth of a second. It can increase, a quarter of a pound of weight on a lift. It could, the changes are magnificent. So mentally, nutritionally, or physically is how we view. So a perfect example of that would be, you know, um, one year the Miami Dolphins went 1 win and 15 losses. It was probably the most dismal season we've ever had.
Yeah, I remember
But
that season.
right, okay. So what was a fascinating comparison is that I was with the Florida Marlins. My first year with them was when they won the World Series in '97, and you look around the room and people are jumping up and cracking bottles of champagne and high-fiving each other, and you look around and everybody is like a superstar. Everybody is charged up, and you realize why you won a World Series is because everybody was brilliant. Well, you know what? That's not necessarily the case. What's necessarily the case is if you want to find your true leader, you look at a losing team, and that is your mentor. So what I was able to see is guys like Jason Taylor, who, when we're doing a 1 win and 15 loss record, that guy plays every game at 100%. You take a guy, I won't mention any names because it's kind of a negative projection of that person, but there was another what we thought superstar on the team who absolutely crumbled. So we realized that, and I had spoken to our team psychologist and said, "Gosh, what is happening here?" And I go, I thought that guy was mentally tough, and he's just falling apart. Look at Jason Taylor. What I learned that I use on my patients is that there's a difference between mental toughness and resilience. Mental toughness is like a 2x4. You can hit it and hit it and hit it with a hammer and hit it and hit it, and then suddenly things start to splinter off, it weakens, and then finally breaks. Oh my God, that guy was like a normal dude yesterday. He went what we refer to as postal. He snapped, he cracked, he went cuckoo. That's what you think, that's what you understand as mental toughness. But resilience is what you want to be, and that's what I teach my athletes is being resilient, kind of like a palm tree, with the winds, especially in South Florida. I hope your listeners aren't in a desert somewhere. They wouldn't understand what I'm talking about. But a palm tree, it undergoes tremendous forces, and those gale forces will bend and bend and bend the palm tree. Some might snap, but most don't. And when the wind dies down, the tree bounces back. Mental resilience. So, are you resilient or are you mentally tough? There's a difference. And so, those are the conversations. While I'm treating a patient, expressing the changes that will go on, chiropractically after a manipulation of the spine, I am talking to them not about the movie they saw last week or what's going on at home. They may come in and tell me that, but I will change it and have a discussion with them about resilience. What does it take to win after a loss? You have to have a short memory for a loss and get back out there and be resilient.
So that's one of the things that you would definitely say separates the really great superstars and the people who have the same physical gifts, that they're just not, that mental capacity isn't necessarily there.
Yeah, exactly. And listen, I'm not a psychologist. I had aspirations of being one at one point in my early years, but there was no such thing as sports psychology. But listen, you know, you as a chiropractor, you talk to your patients, you listen to your patients, and inspiring them is just part of the plan. And so, I gave you an example of what helps human performance from a completely different perspective of what most people view chiropractors as. There's things nutritionally that we talk about, depending on how the patient functions and what's simple and ideal. Something as absolutely purely simple as how much water do you drink during a meal? And they go, well, I always drink a lot of water during my meal. Oh, maybe that's why you're gassy, constipated, bloated, having digestive problems, and then you go out and you're trying to play a game. Well, I try not to eat before a game. Well, then you're sacrificing energy. Then you need to eat. You need to maybe reduce your water intake, because what you're doing is diluting the stomach acids before you consume a meal, and the food is going through your system relatively undigested because you're not allowing that pure hydrochloric acid to get in there and break down the food products. So an hour, drink most of your fluids a half an hour before you eat, or most of your fluids an hour after you eat. And there's nothing wrong with taking little sips of water during a meal. I'm talking about those who think that they can guzzle down a whole couple of glasses of, and I'm talking water is can be a culprit. The other drinks that people have are even more critical. Two glasses of Coca-Cola or 3 cups of coffee or whatever, they're wreaking havoc on their digestive system. So you want to perform better, have better digestion. It could be that simple. It could be that simple. I'm sorry, I get hyped up about all that stuff. So
No, it's okay.
You got to reel me back in, Dr. Chung.
I got you. Let's talk about what people could be doing for their youth athletes. What do you think are some really easy things that a parent can do to help their youth athlete perform better?
Well, it's a great question, because, perform better, it almost doesn't have to be exclusive to the athlete. I sometimes give an example to really deliver the impression to people that what we learn from our pro athletes, our multi-mega million-dollar athletes, is not necessarily just for athletes. Let's take a child that's getting ready for a spelling bee competition tomorrow. And they're not sleeping well at night. They get up and they're having bad dreams or things like that. There's the nutrition component again. You ask little Johnny or little Mary, hey, what's the matter? How are you feeling? Oh, I'm not sleeping good. I feel bad. Well, we know that Dan Marino used to have a glass of milk before he went to bed, kind of on a relatively empty stomach. I am actually kind of making that up to some degree, but most people. I was going to throw out a couple names of athletes, but that do some of that. They really attend to their pre-competition meal the night before, and having some kind of natural, relaxing type of meal that doesn't have a lot of hype to it, a lot of sugars or anything like that, will allow that athlete or that little competitor in the spelling bee get a much better sleep, because they really need that lymphatic drainage going on in the brain at night so they can compete at a high level, whether it be physically or mentally or the combination of the two. So, sleep is everything. So whatever you do as a meal before bed, we usually tell the athlete, take have on your plate for that meal, have a piece of red meat, fish, chicken, tofu, about the size of your fist, and not my fist, but the person that's dining that evening's fist. Um, and then next to it, have maybe something steamed, steamed veggies, or some other vegetables, or salad, or what have you, or rice, or potato without butter, and these are things that would be, or sweet potato would be great. These are ideal uh, meals for dinner the night before an event.
Awesome.
And yeah, you can break it down all sorts of different ways. Meals, but break an hour before the event or what have you. But that would probably be the most usable bit of information.
Nice. Let's talk about you a little bit. So we're gonna get to know Dr. Barron some. What's something that you do for yourself that no one else knows about or not enough people know about?
Well, thanks for asking. I really believe that people have heard enough about me and my kids. I have two boys, a 15 and 11-year-old boy, and they're absolutely my life. They are the coolest human beings on the planet. We have a blast, great connection. And one of them is an athlete, and the other one is a brain. He's got like 149 IQ, but we don't tell him or anybody about that because we don't want him all cocky and everything. But aside from that, I love photography. It has been my passion since I was in high school. So you may see me on the sidelines at home games. At the Miami Dolphins, actually with two cameras strapped to to my chest and shoulders, because I actually, if I'm not treating, I will go along the sideline shooting photographs, and that has been a enormous amount of fun for me, from a reason that you wouldn't even expect it, because I get to freeze action and see how injuries happen. So I didn't even think about that. That was kind of a side effect of the art form. So it's been pretty cool.
You get some good biomechanics research out of your hobby.
Yeah, exactly, absolutely.
So what's one thing that someone in the general public can do today that would make the biggest difference in their lives?
Wow, that's a great question for any chiropractor. They would all have something different to say, I'm sure. For me, it would have to be, I'm all about the self, the person, the way you communicate with yourself and others is a huge thing for me, because what I've realized over the years is communication is probably the foremost, most important thing. It's communicating with yourself and others, and it's the self-talk that you provide to yourself. It's the that's where it starts, and everything else follows. The healing occurs when the self-talk is good. The experience with the chiropractor is even better when your self-talk is great. Whatever it may be, your family, your friends, when you feel enormously well about yourself, and your self-talk is actually, there's an approach that I just adopted this week on how to manifest great things to your life, and that is, it's a personal mantra, and it's euphoric. I am euphorically on purpose. So you take a sensation of feeling sublime, or euphoria, or ecstatic, and where your focus is at. So like my call with you today, I just feel euphorically on purpose with you, with your listeners, but it has to come from me within to start. So, so anybody who's listening to this, it all starts with communication with yourself.
Nice.
Thanks.
How about some favorite books? Do you have any books that you like to lend out to people and say, like, you know what, this will change your life?
Oh my gosh, I love your questions. I absolutely love your questions. There's a couple books I'm reading right now, but one in the past that seems to keep coming up that I read. I went through in 2008. I went through a divorce. I went through at the same time my father passed away. My dog that I had for 20 years passed away. All these crazy things were going on, and I handled them actually very cool. My ex-wife is my absolute best friend. And I have great memories of my dad and my dog. So there was one book that keeps coming up that I hear that I just happen to be reading, and then when I hear people going through challenges, I refer to them to Eckhart Tolle's book, A New Earth. Now, some people feel like there's some religious connotations in there, and that's not. Again, it's the self-talk and what you perceive that means anything. So, it was a good book to ground yourself, and then everything else, you start with a good foundation and everything else is pretty cool. So for me, that was a book that I tend to refer to people, or even just to read a chapter out of it, depending on what they're experiencing or going through. There's actually a couple books I'm reading right now. My whole thing I enjoy more than anything is lecturing and presenting what I've learned over the years to other doctors, to the public, and so I'm constantly communicating. And there's a book called Executive Presence. It's really it talks about partly communication. How can you inspire people? How do you inspire people to rise above the funk or the muddy water they're treading through right now? There's ways to have, when you have an executive presence, an image of I can help you, an image of comfort and confidence. It's a pretty cool book that also addresses how things. It's a self-analysis basically of how you say things, how you appear, what you do, and who you draw into your world. It's a wonderful book. It was actually written by a woman, and it seems to be primarily for women. So if I'm getting in touch with my feminine side, great. No, I'm kidding. But all kidding aside, but it's actually a super book that I actually have been referring women to who feel a little challenged by certain ongoings in their lives.
I think my fiance would agree if I listened to her point of view more often, I'd probably be better off too. So I'm sure I could use it.
Isn't that great? Yes. All right. Great secret that I let you in on. Good. Good.
Well, I think we're going to go ahead and wrap up here, but do you have any last words of wisdom for our listeners?
Oh, goodness. I think I dished out enough. My appreciation to you for, being aligned with the same thought process, and that is, how can we help more people? What can we do for more people in a forum like this is a great way to get that out there. And I appreciate you for all you're doing here and what you're doing for the profession as well.
No, not a problem. I appreciate all the work that you're doing. If people want to learn more about your work, if they want to follow you or get a hold of you on social media or your office, where can they find that information?
Oh, there's my website is obviously www.drspencerbarron. That's Dr. as in Dr. Dr. Spencer, Spencer. Last name is Barron, Baron. Or they could find me on Facebook, connect, ask questions. I love giving answers. We're out there to help the public. So yeah, that's where you can get me.
Definitely. And then for all of our listeners, if you want to get references for the books that Dr. Barron talked about, for links to the studies that we've talked about today, and of course his website, you could go to healyourselfradio.com on our show notes, and all of that will be posted for you. But thanks for coming on board and having a great conversation, Doc.
Thanks, Dr. Chung. I appreciate you. Thanks. Have a good day.
Thanks for listening to Heal Yourself Radio. If you like what you hear, show us some love on iTunes by writing a review or by sharing with your friends. We love interacting with our listeners. You can follow us on Facebook at facebook.com/healyourselfradio. You can find me on Twitter at Dr. Jonathan Chung. And you can always come to our website at healyourselfradio.com and interacting with us in the comments section. Hope you enjoyed the show. We'll see you next week.